guys, we're getting ready to start the next session. I'm gonna let some folks come out. All right, how's everyone feeling? I know we're nearing the end of the day, but we're about to have a great conversation. My name is Sandy. I am the branded execution manager at Unbothered. Are you guys familiar with Unbothered? No? Okay. So Unbothered is the sub-brand of Refinery 29. Specifically, we tell stories through the lens of Black women. So that's anywhere from culture, relationships, politics. We've been around now for about 9 years. So I've been with the company for 5 years. And this is our second time showing up at Essence Fest. And if you see this beautiful setup, this is now the newly wellness house and is now called Unbothered and Well, because we are moving more into a space of well-being and culture. So we're really talking and going a deeper dive on like women's health, whether that's traveling, how are you feeling? We're talking about fibroids, we're talking about relationships. We just had a conversation about gut health. We had a conversation about sex. We have tomorrow we're gonna do a sound bath. All the things that come with well-being and culture, and I'm excited to start this talking circle. And we wanted to create a space that was very intimate. So you've been at Essence Festival, there's a lot going on, and if you come in here, it feels a lot more zen. You know, we're gonna be talking about our feelings. If you want tissue, if you need to cry, be as open as possible, because we invite it and we encourage it. So the way that we start these talking circles, if you want to just start rubbing your hands together, close your eyes, rub it harder, and then I'm going to count to 3, and on 3 we are going to do one big clap. 1, 2, 3. Now I want to announce our next session, the amazing Yolanda, and she's going to be talking about standing on business, okay?
Is this working? Okay,
working.
Hi.
Go for it, girl.
Hello, you guys. I am Dr. Yolanda Ragland. I always start out by saying I'm your Dr. Foot Fixer. I'm the Foot Fairy, and I am the Queen of Toes. And so my subject matter is standing on business, since what my profession concentrates on is securing your foundation through surgical procedures. More specifically, the procedures that I do are bunions, hammer toes, corn removal, but I do it with a cosmetic result. So I don't want people to think that what I do is strictly cosmetic. I like my patients to come in with some sort of symptoms so that it's medically necessary, thereby being covered by insurance. And then I not only get rid of whatever the symptoms are, the pain, I will also fix it so that it looks nice afterwards. What I found early on in my education and in my residency program was that when I saw the results happening on darker complexions, it wasn't on lighter complexions, it wasn't translating the same way on darker complexions. I was seeing these large, huge scars, keloids. And what I found was that the women, mostly women, were just as upset post-surgically with their results. And so now they may have relieved their pain in their feet, but mentally they're not feeling secure in their own foundation. So I decided to be the champion for all of these people of color. It's for everybody, but 98% of the population of my patients are Black women or women of color. So I don't know if there's any questions that you guys might have out there in regards to what I do or how I have started my business, because we are standing on business, so it doesn't have to necessarily talk about feet. We can talk about what Black doctors are doing out there, such as myself. I have decided that I'm not going to participate in the engine. I'm an out-of-network provider, but I can accept your insurance depending on what it is. And that allows me to not have what I call as a foot factory. I can actually spend an hour of my time with you so I can inform you and I can educate you so you can know exactly what's going to happen to your body. And I feel like there are a lot of, I see a lot of us. My practice is located in Manhattan, New York, and I see a lot of black doctors that are kind of like in that engine, and they're seeing 30 and 40 patients a day. So what kind of quality care are you going to get when you do that? So I was just wondering, is anybody
Yeah.
out there?
I mean, we can open it up to like how many people have experienced like foot health like issues.
Yeah, we have somebody here. She wants to.
Do you want to talk about your experience?
So my issues are not with like bunions or hammer toes. I suffer with plantar fasciitis. I've had two steroid injections in my foot, and it relieved the pain temporarily, but it keeps coming back. And I want to know, besides all this stretching, I've gone to physical therapy, what else could I do to relieve the pain? And it's, right now, it's only in my left foot. I did have it in both, but it's like in the heel pain. First thing in the morning, I'm tiptoeing because
Yes.
it hurts so bad. So I just want to know if you have any advice on how I might be able to treat that.
Yes, so I think you did the right thing. You always start conservatively. We never want to jump into surgery without exhausting our conservative options. I'm happy to hear that you only had two steroid injections. So, what people need to know is that a steroid is a wonderfully horrible drug. It's wonderful because it can actually relieve the symptoms because it's inflammation that's happening in the plantar fascia. And so what's happening, you're getting these little micro tears. Think of your plantar fascia like duct tape. Really hard to tear, right? But if you get it's a little micro tear, and around there you're getting this inflammatory process. So they give you the injection of the steroid to get rid of the inflammation. However, steroids can be very destructive, and it can't differentiate what it's trying to target. So you can wind up tearing other things, ripping other things. You have to use steroids methodically. You shouldn't get a steroid injection more than 3 times in the same area within a year. So if a doctor is trying to inject you more than 3 times in that same area within the same year, you have to say no to it. The other thing that it can do is break down the fat pad. You have cushion underneath your feet. Okay, those are your shock absorption, and it can get rid of the fat pad, and it will never come back. So then it can make things worse. So you've done the stretching exercises. That's what you're supposed to do. But when you do the stretching exercises, you have to always do it. It has to be something that has to become a full routine. So when you're watching TV, you pull the towel around the ball of your foot, pull your toes to your nose. I'm sure you know that exercise. And you have to do that all the time. If that's not working, now we go to a surgical option. Now, I'm sorry if I'm being a little sexist here. The male doctors, I always say they let the boys and their toys, and they like to use the scope, and it looks really cool in the OR, and there's a camera, and it looks really cool in the OR, but you got to put that camera through the foot, and you're disrupting things. So you're creating like more lesions and things like that. I have a technique where I literally will go to the palm of your foot, do a stab incision, fish out a little piece of that fascia, because the boys with the toys are going to be doing the same thing with their big scope. But I'm going to finish faster. You're going to have less scarring, and you're going to have instantaneous relief. And I fish out a little piece of that fascia. We cut a little bit of it. We don't want to cut all of it. What that does is it lengthens your fascia because your fascia is too short. So every time you're standing on it, you're pulling on this taut tendon-like structure, and it's ripping. So when we cut it a little bit, it makes it longer, and it will scar in. And then your plantar fascia is longer, and that cures your plantar fasciitis. Anybody else have any
Anyone else?
questions?
for decades, only on my left foot, that pad, that fat pad you talk about with the shock absorber, there is a hard circle that just always comes. It can be shaved off, but it will always come back. It's never been any place else like a different foot. Is there anything I can do about that? Because it does get painful if it's not shaved off, or
Okay, so
what is it?
So it's a callus, and calluses can occur for different reasons. So sometimes we have something, there could be a little tiny hole that's centralized, and that's because one of your sweat glands has calcified, and that can be super painful. And then, they shave it off and they try to carve out that little, we call it like the eye. We try to get that little calcified piece out, and it is something that you have to work on all the time. Calluses are difficult. When you get corns on the top of your feet, I can fix that because I know it's due to bending. You can't really do it on the bottom of your foot. It's just the risks outweigh the benefits. So it is really keeping up with it. But you can use something that's like a gentle acid, urea, and I have a product called the Soften Our Soul Stick, and it has a little bit of urea in it, and what it does is it keeps it under control. So I would advise having something like a pumice stone with a stick inside of your shower, so that daily you're giving it some gentle debridement. You may have to do sharp debridement with something like a scalpel, or they have like the cheese grater. They have those, but I usually don't advise you doing that on your own. You really should have a medical professional do that, especially if you have any other comorbidities like diabetes or vascular insufficiency or anything like that. But it is something that you do have to maintain, unfortunately.
I have two questions. One is about what if I'm experiencing like numbness or tingliness in the bottom of my feet.
Mm-hmm.
So if you can address that. And then the second question is if I have swelling or in my ankles and feet as well, what can help relieve that?
Okay, so with the tingling, there's a number of reasons that can cause numbness and tingling. This is always associated with nerves. We usually call this neuropathy. Oftentimes it's associated with diabetes. I'm not sure if you've been tested for diabetes, but a lot of people are diabetic for 8 years before getting diagnosed. So maybe you do need to check your hemoglobin A1C to see if it's something that might be metabolic, like I said, like diabetes. And then if it's not that, it could be medications. Certain medications can cause neuropathy, but when you feel numbness and tingling in the bottom of your foot, it's telling you that there's something going on with the nerves, and that they're not getting the signals properly, and it can eventually lead to numbness in that area. As for the swelling, a lot of people don't. They get massages, but they don't they don't think about draining their lymphs. Lymphatic massages are wonderful. Sometimes your lymph nodes are just clogged, and they need to be released. So when you get a lymphatic massage, it kind of it doesn't feel like they're doing anything. It feels like somebody's like jiggling on you. But what they're doing is they're kind of like vibrating that lymph node and getting it to release so it can do what it's supposed to do and flush out the inflammation that you're feeling around your ankle and your knee. So that's one of the things. I mean, this is all for educational purposes, but I would consider getting a lymphatic massage. My mother went through the same thing, and she did everything else. She got the compression socks, and you can do that. You get the compression socks compression's always gonna help. But I said, try the lymphatic massage. Maybe your lymph nodes are just a little clogged. Anybody else? There we go.
Hello, I know you mentioned you do the surgical as far as with bunions
Hmm.
and things like that. What's this? Uh, what is the stages for like treatment? Maybe before you get to surgery, like you see all these different products on social media that they'll use.
Okay.
Do they work? No.
Okay, so that's a great question. So I'm always on social media because I get a lot of my patients from Instagram, and I keep seeing these bunion splints and these bunion contraptions. And let me tell you something: if they worked, I I wouldn't be doing what I'm doing. Um, a lot of them they work in theory. I mean, theoretically, they sound like a great thing, but they're not going to really work because you gotta keep your toes splinted in that position while you're walking, and they require you to wear it at sleep while you're sleeping because you're not strengthening the muscles that are imbalanced if you're just asleep, or if you're not ambulating. But you should exhaust, like I said, your conservative treatment. Change the different types of shoes that you wear. Maybe even use a toe spacer, a bunion shield, so you're not getting the rubbing on the side. Um, any of those things. And then after you've tried all of that, that's when you want to talk to somebody who can surgically manage it. Now, the thing I want to point out to you guys when you're seeking out surgical management of your feet, that most podiatrists are general podiatrists. So they do a little bit of everything. They do a little bit of sports medicine, a little bit of diabetic wound care, routine foot care, and then they do a little bit of surgery. Um, Orthopedic surgeons. Some people think that orthopedic surgeons are the better ones to go to. Orthopedic surgeons, most of the times, they work on bigger bones. Shoulders, hips, knees. And when we get down to the foot, if they're a foot and ankle specialist, they usually deal with trauma. So it's different. When somebody goes in for surgery for trauma, they're just like, just please put me back together again. But when you're going in for something like a bunionectomy, that's different. It's a different thing. You want the relief of pain. It's a smaller bone. Um, you have to make more precise cuts. So when you are seeking out somebody to surgically manage your foot, you want to make sure that they really know what they're doing in that regard, whether it's a podiatrist or an orthopedic surgeon.
I noticed, so I heard her say plantar fasciitis or whatever. So I noticed when I wear heels, I can walk well and my feet don't bother me. But then when I go flat, I'm like, why am I having bother with my feet?
She's right. So plantar fasciitis hurts when you wear flats. You can't wear super flat shoes. Flip flops, ballerina shoes. If you walk in those for a long time, now you're really pulling on that plantar fascia. So even just a little lift like this is going to help you. So a lot of like when I used to work in some of the Latino clinics and like, oh, baila, no problem, in my heels, whatever. But it's but as soon as they were like, but they couldn't get up in the morning, get out of bed because it was hurting so much. So I always like when I write about things and talk about things. Flat shoes that are too flat are no good, and shoes that are too high are no good. You have to wear everything in moderation. Just keep that in mind. Do I wear flip flops that are super flat? Yeah, but I'm not walking 20 blocks in New York City doing that. And do I wear high heels? I absolutely do, but I always have my safety shoes with me. I have safety shoes for these. See, they're right there.
Is this safe?
Huh? So you have an arch support. It's lifted a little bit, so it should be. But if it doesn't have an arch support in it, and maybe it's not lifting your heel enough, then that's not the shoe for you.
Anyone have? Oh, yeah. One. This is the last question.
Okay, I have a question. So we oftentimes feel like we need to get our teeth done, we need to get a little bit of cosmetic surgery. How important is it that when we have issues with our feet that we really stop neglecting that?
So I think that's a great point to point out. I notice, especially in our younger population, we're getting snatched. Even within our celebrity population, we're doing everything. We're doing our face, we're doing our body, but you see them walking down the runway and their feet look crazy. And I think that it is a scary notion to get foot surgery because you think it's going to be so debilitating. But really, under my care, now everybody does things different, but under my care, you come out of your post-op shoe in about 16 days. Then you'll go into something like a Croc or a sneaker type shoe. So it's not as bad as they think the recovery is. But to go back to your question about should we neglect it, no. I mean, if your toes are starting to overlap or cross, it's time to get things done because it's only going to get worse.
Yeah, we can end here.
Okay.
Yeah. You can, if you want to close out.
Okay.
One last close out.
Oh, so you just want me to end it like this?
Take care of your feet.
Take care of your feet.
Yeah,
secure your foundation.
Yes.
Take care of your feet. You can find me on fixyourfeet.com.
Yes.
You can find me on Instagram as well at Fix Your Feet. You'll see all the before and after pictures, especially on the Instagram. There's a lot of information. If you scroll down on the page, you'll find it chocked with a lot of good information.
Thank you so much. That was great. And we want to end the talking circle the way that we opened it. So we're going to close it by rubbing our hands together. Keep rubbing really fast. You can keep your eyes open or closed. And on the count of 3, we're just going to do one big clap. 1, 2, 3. Thank you, everyone. Enjoy the rest of your afternoon.
Now I'm